I'll come to Deepak sir, I'll come back to you later. So Deepak sir, as we were discussing on digital transformation in hospital, what benefits can we expect out of it?
Well, first, before that, I would like to answer on one regulatory question which you was talking. One of the important regulatory is about the medical device also. We find that the fire has started with the medical device, because we don't have a good approval system like the CE or FDA. Those CDSO has come, but it has not been applicable to all the medical equipments. So we need to have the stringent norms like what has been put by FDA or CE, so that these kind of mishaps cannot happen. So now answering to your question on the digital transformation. So I had an opportunity to visit one of the hospital, so within India. So I was thrilled the way the digital transformation has happened. They had an experience. The hospital is around 30-year-old. They tied with most of the major players, so national and international players, in terms of building the HIS or EMR and integration. But whatever the expectation from the users were not been met. So then they started their own journey of having their own people building the digital transformation. So that has led to us, right now the ground situation is like this. They are able to get all the information in a single click in their mobile, and they are able to take a decision. So what I would emphasize by 2030 is to have a thing like a digital command center, which has a clinical command center as well as a non-clinical command center. Clinical command center should be like any of the hospital, any of the buildings where the BMS, there is 24/7, there is a monitoring or CCTV monitoring. Same thing should be applicable in a clinical areas where the clinicians are sitting and seeing the real-time information of all the patient information related. So data interoperability is very important, because you get data from the EMR, you get the non-DICOM data, DICOM data. All these should be uniquely tied to a patient. So thanks to the accreditation wherein patient unique ID has been harped upon. So we need to ensure that these data are being tracked, and with the AI analytics, we are supposed to get the alerts well in advance so that the actions can be initiated. So this is one of the important things which we can do as a part of the digital transformation, so or a clinical command center. So we also have the non-clinical command center, which is also very, very important, because as we are discussing, the energy cost is very high. So are we really monitoring it? Energy management, the intelligent building management, security control, CCTV, access control, fire, patient flow management, parking management, queue management. So all these things are very, very critical. So is the patient and visitor experience. All these things can be clubbed as a digital envelope, and as a part of a patient experience, we need to ensure that we build an infrastructure toward future, so that all the touch points related to the patients are being captured. So one of the important things which I have noticed is predicting clinical decision support systems which emerge because of these touch points. So we are able to see whether the sepsis is going to happen or cardiac arrest is going to happen based on these things. So are with the non-clinical data, whether any department anywhere the threshold temperature is going beyond that, is there the energy in a particular area is more than this. So overall, yes, the investment is high, but towards the end, if it has been, I have seen again one other hospital wherein they have an access control and CCTV, but if you still see the number of manpower deployed where the security is still same, so that will not work. You need to plan in such a way that all these things are being looked in totality and bring the digital transformation. That is going to make a difference to the hospital in future.
Thank you. Thank you. So, sir, again, for us, can you please explain what is biophilia and what's the advantage of